The Kraft test, have you talked about that on the show yet?
Not yet.
Okay, that's a really good test for insulin resistance. You can YouTube Kraft test. There's a doctor on there that explains it really well. It's similar to an oral glucose tolerance test, which is where you take a bolus of like 75 grams of glucose, which is disgusting, I know. But if you're really interested to know if you have insulin resistance, this is probably the best test to do. And then you test your blood glucose at 30, 60, 30 minute fasting, 30 minutes, 60 minutes, 2 hours, and 3 hours. So that tells you your glucose curve, right? But if we want to know your insulin resistance risk, we also want to check insulin. So a Kraft test, K-R-A-F-T, is you take that bolus of glucose and then you check your insulin and glucose fasted. You check it at 30 minutes, 60 minutes, 2 hours, and 3 hours, and you get a glucose curve, but then you also get an insulin curve. And so you can see if your insulin is way elevated or if it stays elevated for a long time. That's pre-diabetic before you're pre-diabetic, essentially. So I think that's a really excellent test. Just getting a fasting insulin test is beneficial. We sell those directly through our website, depending on, like, a few states have regulations. But I started doing that because people would come to me and they'd be like, I went to my doctor to get a fasting insulin test and they looked at me like I had two heads. And then there's one response is like, I talked to my friend who's an endocrinologist, and he said that they only check fasting insulin. This is like my doctor voice, He said we only check fasting insulin if someone's type 2 diabetic. And even there's a stigma about these continuous glucose monitors. One of my members is a nurse, and she's lost 75 pounds, and she was talking about her continuous glucose monitor at work. And one of the doctors is like, "Why are you checking your glucose? You're not diabetic." And she's like, "Well, because I don't want to be diabetic." And so I think that is a really big thing that doctors really need to learn about the powers of checking insulin. And Dr. Robert Lustig, in his book Metabolical, he's like, please give a copy of this book to your physician. They need to know this information because they're not learning it in school. Because let's be honest, disease prevention saves a lot of money. Disease prevention saves a lot of money for the patient, but it costs a lot of profits for pharmaceutical companies, for physicians, for hospitals, for big food companies. Prevention does not sell. That's why it's not covered by, most insurance companies. That's why it takes a grassroots effort from people like me and you to bring this real evidence-based information to the public, because their doctors aren't doing it, because the doctors aren't being taught that in school, because the medical education is really about diagnose and treat with a prescription. Not necessarily how do we fix the root cause problem, unless they're going on to like functional medicine schools or other continuing education programs, which are out there. So yeah, I think a big barrier to treating insulin resistance is awareness of the condition in the first place, and how preventable it is and how reversible it is, and recognizing that there's a lot in our environment that goes against what I'm saying. So you have to kind of you have to learn how to be okay with being the outlier in your family or your community. You have to be, I like to say, be the thermostat in the room, not the thermometer. You set the temperature of how you're going to act, what you're going to eat, when you're going to bed, how you're going to move, and everyone else can follow suit. But don't be the thermometer in the room, be like, hey, do you want a drink right now? Like, no, I don't want a drink right now. Thank you very much. Do you want that extra piece of, no, I don't want that extra. Like, don't blend in, like stand out, figure out what you want, and then do it. So be the thermostat, not the thermometer, because this stuff, these lifestyle changes, they are not a quick fix. They're not. And so I think that's the hard sell on what I do. Getting people to change their thoughts and change their behaviors is a lot harder than selling them a weight loss pill. I'm like, here's some Ozempic. Take it for 6 weeks. Take it for 8 weeks. Give me thousands of dollars, But I'm not actually going to change you. I'm not actually going to tell you how to keep the weight off. I'm just going to help you lose it. You might feel miserable along the way because you're going to be like super full, so you can't eat anything. So you're not going to have any energy and you're going to lose a lot of strength. But here's a pill to solve your problem. It's like, no, we have to get out of that mindset in medicine.
If you enjoyed that clip, press here for the full episode. I'll see you over there.
If you have a high fasting insulin, if you have excess abdominal fat, if you have high blood pressure, high triglycerides, low HDL, low energy, frequent carb cravings, those are all signs of insulin resistance. Insulin and inflammation are hand in hand.